Hello everyone, welcome to my YouTube channel. Today I'm here with
Kemi, professional auntie.
And we will be discussing how it's like to be a nurse and to be a midwife. And so yeah, stay tuned, keep watching to find out what it's about. So Kemi, welcome to my channel. Thank you for coming.
Having me.
That's midwife actually.
Good,
yeah.
good.
It's always adult nurses or child nurses.
Yeah, this is your field. Yeah.
So it's nice to, have a change and to explain to everyone as well, what it is that you do as a midwife in comparison to nurses. Yeah. So let's get started with the questions. So guys, I came prepared, with my questions. Okay, so I just want you to first of all introduce yourself, explain who you are, your journey into becoming a midwife.
So as I said, I'm Kemi, professional auntie by brand and by my business trade name. I've been a midwife for nearly 11 years in December. Sounds crazy to say out loud. I feel like, but yeah, it's gone so fast. I kind of went straight from college to university, then straight into working straight away, kind of like yourself, isn't it? And so I've been doing it. I kind of knew that from about 10, 11, I wanted to be a midwife. And I followed the route straight away into the working world of midwifery. And then I've now, I think 7-8 years in, I decided to branch off into professional auntie, to more private services, to more individualized care, and came about the brand of professional auntie.
Nice. So can you just explain to the viewers who may not know the role of a midwife, can you just explain to them what it is that you actually do?
Of course. A midwife is someone who cares for women, families during the time when they become pregnant. So conception, find out they're pregnant, they see a midwife as well as a GP, but the midwife takes over the care alongside a GP, and they see them through antenatally to labour and postnatally. You have different kinds of midwives, but generic one that you will see is just for during that journey of pregnancy, labour and then postnatal care that you receive. There's specialist midwives as well, won't go into all of that, but midwifery is more about preparing the antenatal care, making sure they receive that, and then labour care and also postnatal care you need for mum and baby and family after.
Okay, that's interesting. So another question I have is, what do you believe are good qualities that make a good midwife?
I feel like midwifery has to be passionate about the role. It's not the kind of role that basically you can't have a love for families or birth, because it's such an important time in a family's life, and you make such a difference. Even I always say that I may not remember the mother, the father, all the people in the time, but they'll always remember you.
That's so true.
You're such an important part of their story, and they will remember every single detail of that story because when their child came into the world, even the care they received. So I feel like you have to be passionate, you have to be a very people person, you have to be patient, caring, nurturing. Patience definitely, because it could be a long journey with them. Be a very good communicator. Have intuition. There's a lot of things during your we call like your midwife intuition that you have. All things are a bit different. Inquisitive, ask questions, and also be a very good advocate. Kind of different we'll go into probably later about as midwives. And nurses, you have midwives, you have to make a lot of decisions as well. So you will advocate for your family, your woman, during labour in terms of that doctor's decisions they make, and also decisions that you will decide together with your woman, and you need to be able to make sure that you are a good advocate for them. So I think advocacy, good communicator, caring, nurturing, and also a love for the job and sort of passion.
I think that's interesting because what you're saying, we said we'll get onto the topic a bit later on, but what you're saying does actually interlink with nursing as well. So that's really interesting. So another question I have for you is progression into midwifery. How is that like?
You mean how levels you can go up.
Yeah.
So
for anyone watching who thinks they want to become a midwife, but they also want to view like routes into progressing within the field of midwifery.
That's a very good question. Sometimes within midwifery, a lot of people can stay at one place. You become a midwife and you either be a community midwife, so you work in community and mostly you give like post-antenatal care, or see the family after they've given birth and give that postnatal care. Or you can be the kind of midwife that you are there during labour, so you work on the ward, you work on the labour ward, you work either when they come in with any concerns, like a in hospital midwife. So you can find yourself there. This is usually at a certain kind of level, band 5 and 6, for people that's kind of like branding of period scales or what kind of level. Progression itself in there's a lot of progressive roles. I think I spoke earlier about specialism. You can have an education midwife, a practice development, one that supports students. You can have like one that's focuses on like fetal monitoring, so that means that babies itself, when they listen to them during labour. You can have ones that are diabetic, hypertensive midwives. You can have all kind of different medical conditions and you focus on that, and you can have, they branch off. Then you can go into management in midwifery, so making sure that you think about management, think about the auditing and all those kind of things. There's so many areas that go to like a higher banding. Where do you decide on progression, where your passion lies? I think in the days where you're level 5, level 6, you start to decide about what you found your love for. Is it mental health? Is it whatever it may be? And then you decide from that point onwards, and then you find your route through there, through experience, through shadowing, through more days, and then you get to find where you want to be in your midwifery journey and progress from there.
I think it's really interesting that you've spoken about that, because I think it's extremely, extremely important that wherever you're working, whether you want to be a midwife, a nurse, anything, anyone, whatever professional career it is, that you really do find a speciality or whatever it is that you're doing, you make sure that you enjoy what you're doing prior to thinking of even progressing. Because a lot of people want to progress, but it's not just about progressing, it's about loving what you do
100%.
And then progressing within that. If you don't love what you do, then you won't be happy and you won't be doing well or helping others effectively. So,
definitely. And there's so many research midwife, there's so many, we could be here all day naming it. So if you have a passion in a certain area which you developed on the journey, there's ways to get into that. And if you're someone that likes to do management, you don't want to be hands-on more or give that one-to-one parent care, there's management roles within midwifery itself.
Lovely. So advice you'd give to a young generation of midwives?
Oh,
the famous question.
I know. I love seeing younger generations like starting midwifery, because I feel like we need the new in the midwifery itself. And I feel like when you start your midwifery journey as a young midwife, do not think you have to stay in one place. You have the chance to explore, travel. You can travel around, see where you want to be, explore, get the experience, research, try to work in different hospitals, don't stay in one place. I would say make sure that you think about creative ways to be a midwife. Sometimes people think that you can only work in hospital, you can work in community, but even like the way I'm working, how can you prioritise services? What kind of things do you have passion for? What kind of ways do you really want to help? And I think the great thing about the modern midwife and the modern world we live in is social media. The creativity, informative ways you can provide information to your community, what doors that open for you. Have a platform. I think using social media as a platform in a positive way has helped so many people like yourselves that inform people, and people that are in the community love it. Families are learning from midwives, nurses, yourself, and the content you put out can be such a great way of you having something you love, which could be content creating, but also sharing valuable information that people do need. So I would say be innovative, get a lot of experience. Don't just stay in one place, explore, even move around, travel hospitals, and have a community. I think it's so important to have other like-minded people like with your profession, those at your level and those higher. So you have those that can give you the experience, the wisdom of what they've done, or have someone that you want to see yourself here. So like someone that you may look up in nursing or somewhere else, like, oh, I really love what they do, and then they could be like a little shadowing, a little mentoring itself, and what steps they take to get there, and you can have that little guidance as well. So I think it's really important in your early days to get your skills up to a good place before you start jumping. Get your skills in a great place, because if you're great skills, you're confident in your role, the world's your oyster. You can do anything, you can move anywhere and not feel that fear of working anywhere. So I think that's really important.
Really well.
Now your home birth midwife, they will see you at home, and they'll be there when you want to deliver the baby at home and give support to you for home births, and that would be for that labour care given not in hospital but given at home. And the postnatal midwives in community will see you once you go home. They'll see you the day after, see you on day 5, day 10, and give you the extra support you may need postnatally. So community midwives, usually what they do there is that same kind of care you would give, but follow up, seeing your home environment, seeing clinics, and have that support network around you as information, health promotion, and guidance for you during your pregnancy and postnatally.
That's nice, because it's nice for the women to always be having support.
Yes, definitely.
It's interesting. So I would like you to explain some midwifery myths. So this is the part where I'm going to intertwine midwifery and nursing. So I feel like that's already one they've kind of explained already.
Yeah, the TV false. One push babies out. False.
I have friends who are midwives, and they explain like they've delivered a certain amount of babies.
Yes.
So I just want you to explain to the people who may not know, because I feel like with midwifery you're much more independent than we are as nurses. Yes. Not saying that my nurses are not independent.
No, you are.
But I know that you guys do work on your own much more.
One of the differences probably will be the autonomy that's given to midwives.
Yeah.
We have autonomy of our practice in terms of even giving medication. We have like a prescribing list that midwives are exempt to prescribe in case of caring for the women. So we don't need us to prescribe these medications that we've been given as a set. During labour, we obviously have doctors on the ward round itself, but we have also a low risk birthing units that midwives control the labour of doctors not intervening unless it's emergencies. So midwives have autonomy to actually guide the whole labour process and medical care under them without having doctor intervention if it all remains within a low level of control. So autonomy will be that delivery of care that, they deliver the babies itself. Whereas some places like America and other countries where you may give the care as midwife, but you won't actually deliver the baby. So sometimes people come and go, oh, where's the doctor? And we're like, we're fine, it's us. So that preconceived notion, sometimes people still believe doctors deliver babies, but that's not actually true. Midwives deliver babies unless there's a risk baby's not coming, we have signs of distress with baby. Then things like instrumental deliveries, what is that? Ever heard of something like a forceps, a one-tooth delivery, where you put a cup on baby's head? Those deliveries where it needs more interventions, a doctor will do those deliveries. Cesarean sections, out of our remit, a doctor will do those things, that's operations. So that's when we have that joint care together, but the care itself, we get on with it. We only bring them in to review things, and that's on the delivery suite. Low risk like birthing suites where some people want to go there and they'll have no drugs itself, just like gas in there and like pethidine. They ran by themselves. Unless there's an emergency, baby's born in distress, then doctors step in. So that's the autonomy we're given without having the need to ask doctors, should I do this, should I do that, or to sign off medication for us. We have exempt medication we can give ourselves and follow the care all the way through the end.
With nursing, obviously it depends. I think with nursing there's many things that you can do, but if you want to do stuff like prescribing medication, you have to go and do a prescribing course, and then you'll be able to like independently prescribe medication for a patient. Otherwise you'd have to wait for the doctor to prescribe that medication, and then when it's actually on the drug chart, then you can actually give the medication. So that's one aspect which is quite different from what you're explaining. I think also, of course, we are able to assess situations and then escalate our concerns to the doctor, but sometimes I feel like unless you're doing an extra course, unless you're doing your masters or something more, or becoming an advanced nurse practitioner, it's kind of limited as to what you can do to meet the patient's needs without escalating.
Like on an entry level. So whereas like, you entered on your band 5, this is basic for all nurse midwives with band 5, you'll be able to deliver in a low risk unit. But I think with yourself, what you're saying is that you get to, you have to do extra course and it's not everyone.
No. So even though, so I'm a band 5, so band 5 is like entry level of nursing, so a newly qualified nurse. But even if I was to be a band 6, which is like a sister, it wouldn't change the fact that I wouldn't be able to prescribe medication unless I go to do my masters or do a prescribing course. In comparison to like what you're explaining.
So what makes you guys, from band 5 to 6, what's the change?
So the change is more responsibility in regards to being in charge. So it's more about the ward itself, ensuring it's more of a management role basically. But how many births do you need to complete until you can actually like be delivering babies on your own without any guidance whatsoever?
one thing that's remained quite consistent in the midwifery journey itself, education-wise, is the fact that how 40 has been the same number. So as a student midwife, you need to complete 40 births. And prior to this, they did like 5 or births you have to observe first, then you're 40. But I think now they've changed it to basically you can just go straight for your 40. Okay, you will not pass or not move on to being qualified if you've not had the 40 completed births. You've got more, great, but you need to have met it at the 40. So everyone that's midwife who were delivered as qualified had to have come in at entry level or delivered the minimum 40 births. Yeah.
So let's take it back to when we were students. I just want to know the difference, like, because for me as a student nurse, when I was a student nurse, I literally, everything that I'd done was under supervision. Only like in my final year was I really more independent in regards to taking my own patients, obviously under supervision, giving injections. But how is it like as a student midwife and actually being able to deliver babies? Because I know that as a student nurse, even though I was a student, some people were a bit hesitant, which I understand.
They're pin.
They were a bit hesitant to letting me do things independently. Exactly. So how is it like just even asking like the patient, I'm a student midwife, am I able to deliver your baby? Like,
great question.
Would they not be scared?
Great question. I think one of the things we do set off with an environment to say, and I think usually even in antenatal part, is that our midwife can prepare them to so that sometimes you can have students around and then come delivery. Some people will say point blank, we don't want no students. We can't change that. But most women are happy to have students, and they say actually it's quite extra care. Because someone that says a bit like more adulting to them sometimes when we do documentation, so that's been good. So we do have declines, and you do have to ask permission of that family to have a student present during the delivery or to deliver the baby. It's like, and sometimes some of the families are happy for them to observe, but not happy for them to be the one that actually delivers the baby. Even when they're delivering, we don't just say, I'm not turn a blind eye as a supervisor midwife and let them get on with it. We're always there on hand on deck. Even sometimes in some hospitals, there's always 2 midwives in the room anyway, because you've got a mum and baby, there's 2 lives involved. Sometimes you do need an extra pair of hands and someone that's going to be doing certain things, especially if things emergency happens, things like that. So when you're a student midwife, you have to observe, you have to deliver. Like I said, stages. First stage, you try, maybe first year a lot of people are given information, observe, learn how the things go.
I think that's the best way.
Yeah, you don't jump straight in.
Yeah, so anyone watching this, if you're in your first year, don't feel as if people are being mean to you by letting you observe or doing things a bit repetitively. Like, I know that with me as a first year student, I was always doing observations. But it's better to do something over and over again, to understand what you're doing, than to just be hands-on doing things that you don't understand, because later on it won't help you.
Jack of all trades, master of none. You want to make sure that you've mastered this skill. It can be boring, I know. You've been always doing the same ops, and I feel sometimes, especially with midwives as well, they get so confused at number 40. I've only got 10 births, and there can be a competition between each other. The births matter, of course, you need a number. However, if you can't give the good care during that time, you've missed it. You know, so making sure you're able to pick up on risk, give the right care, do examination, you know, those are very key things. I think the areas that people struggle with is examinations, like vaginal examinations, and that's assessing progress. Can be one of the kind of things that students leave maybe at the year 3 not as confident. I remember my first time, I'm like, oh, do I know how to examine properly? You know, and it is something that how a lot of the role, you will, like you say, you do master it after you've qualified. There's certainly still going to be, that's like a preceptorship year. So you have your newly qualified year where you're still going to be shadowed, you're still going to be supported. However, you're just more, we trust you to be a safe person. You know when you're in your remit, you know when to ask for help. That's the most important thing, that if I'm out of my remit, I know I need to ask for help here. But I'm still working safely, which is within the remit, I know what to do. And I think that's what's important to do. Second, third year, you have midwife has caseload, so you follow women throughout the whole care. That gives them a bit more confidence as well. So I think it's so important that don't chase the 40 births, chase the care, chase the fact that you can give all the skills you need, and you're confident in doing that. Like you said, repetitive things doesn't mean that we're just giving you the side, we're making sure if you can't do record keeping, how important is it to make sure that, okay, birth's important, but can you record things appropriately? Have your records are your life. If it's not written, it never happened. I think we've all been taught that, so it didn't happen. So if you can't you can't multitask that, you can't do that, then we've got problems here. So those things are key skills you want to be able to learn on the journey, as well as your births, as well as other things. But care for women is so important.
This round is about, it's like a little game. Okay. You know,
I like
try to
games.
spice up. Okay, so the first question is, okay, we're gonna just kind of switch roles.
Okay.
So, if you were, if I was a midwife, what kind of midwife do you think I would be?
I think everyone will love you. I mean, you seem very calm and very serious. So I feel like you'll be the kind of midwife that basically is really with a woman. I think you would work really well on the lowest unit. The calming environment, the one that basically like how you're ready with them, listen to the needs, get the thing dim lights. There's really those kind of midwives that they work really well on the lowest unit, and there's ones that really thrive in the ones that have doctors around. I think you do really well in the low risk one, where you're one-to-one with the woman and the baby, and you really enjoy that one-to-one care. I think you would really thrive there.
Okay, what kind of nurse do I think that you would be? See, with nursing, there's so many different specialities. Now to think of a type of specialty. Do you work well like under, like, do you like a lot of chaos, like a lot of going on, or do you prefer like more of a quiet?
I don't want quiet, but I like steady going. So things keeping me busy but going steady, because I like to be able to give the best care in that time. Chaos can mean I'm doing so many things at once. Like I said, you know, you can be mastering so many things, but are you really focused? You know, you get on with it, but I don't feel like I've had a moment and I'm always on the go and everything's all over the place. I like steady, good things, but you know, that kind of way.
Okay, I feel like I was going to say A&E before, but after that,
no way.
So I think you'd be a nice gynae nurse.
I actually was, when I done my gynae placement, funny enough, I did thought, oh, should I be a gynae nurse? Should I do that? But I enjoy gynae. I think I'm just generally women's health. I'm a woman's. I like all stuff like that. I'm there.
Nice. Okay, next game question is, okay, so when do midwives begin checking for like dilation in a woman?
So you have early labour, so it's 10 centimeters dilated. We know labour begins from 4 centimeters dilated. Okay, so people, however, can come into what we call triage, assessment unit, when you're thinking labour and you have any concerns coming with contracting, can come in to be examined and be in pain, not coping with pain, and ask to be examined, and then we can find they're 2 centimeters dilated. No one wants to hear that actually. But 4 centimeters dilated is when we usually want you fully dilated. However, what usually presented with that makes us think we should examine you would be contracting at least 3 minimum in 10 minutes, lasting about 40 to about 60 seconds. In that 10 minutes, either your waters have gone, that we're going to indicate that we should examine you, and you're contracting. Things like you're bleeding, those kind of things can be, or your labour, or we want to induce you. So induction requires like examination to obviously apply what we're going to use medication to actually start induction process for you. So 4 centimeters is either active labour, what we call. Anything before then is what we call early labour. From 4 centimeters dilated, we have like a threshold of every 4 hours to examine you if you consent to, and that's the minimum. We can do it sooner if need be.
So now we're going to guess who am I. Okay. I work as a healthcare professional and I'm able to listen to a baby's heartbeat. Who am I?
A sonographer.
Yeah. Do you mind like explaining the role of sonographer for those who don't know?
Yeah. So sonographers usually are in community itself, like either hospital based usually, and they're the ones that do ultrasounds to find out either the gestational baby. Usually when you first find out, you go for your first scan, usually before 12 weeks. So 12 weeks will be your first scan, 11 to 12 weeks your first scan. Make sure the baby's okay, make sure the baby's in there, make sure everything's growing okay. They do all the kind of things, see the heartbeat like you said. And then we'll have a second one, which will usually be at within the 20-week mark. And that's usually where people can find out they want to, if they have a girl or boy, and do a more detailed scan at that time. So that things are checking for other things. And if you wanted to do tests for things like Down syndrome, any abnormalities, they'll be requested at that 12-week scan as well. And that's at early stages to find out too. Yeah. Later scans, some hospitals offer like a 36-week scan. Some people have to have multiple scans due to previous history, like you've had a stillbirth in the past, you've had a premature baby, restricted growth, you have more scans. But the minimum usually 2 scans for a normal level. But anything extra, any concern, you'll have extra scans.
Interesting. And the reason why I find it really interesting is because I work on a gynecology ward, and so we do have nurses who are also sonographers as well. Yeah. So it is interesting or sometimes sonographers, like midwives, come to the ward
to do the scans.
To do the scans as well. So that's
it's a great skill to have, I think. Definitely. Sonography is a skill. And there's money in it too.
I think it's actually really interesting. Okay, so another Who Am I game. So I work in a divisional team and care for pregnant ladies postpartum. I ensure that I advocate for them and help with educating them. Who am I?
Postnatal midwife, educating them. Community midwife. Is it community midwife? Yeah.
You weren't even sure yet?
Maybe.
It is
community midwife.
Yeah. So community midwife has been this theme so far. But yeah, it's really interesting actually that you spoke about the fact that community midwives also work in clinics and they help more than I knew, and more than probably the viewers knew as well.
It's very important role as well in the community.
Okay, so if you weren't a midwife, what would you be, or who would you be?
I think we kind of touched on it, I definitely would have looked into gynae nursing. I think it's the only kind of nursing that I think I would ever want to do. What would that have been? So hard. I did want to do children's nursing, however, I just felt like I couldn't deal with unwell children or tear at my heartstrings, I would really struggle.
That is actually
I would really struggle, so I thought, Kemi, don't put yourself in place like this, you would struggle. You come home every day crying, so I thought, no, we can't do this. So I think gynae nursing would be something that would be up my street. But if not, something definitely very people related. I'm a very people person. I couldn't imagine myself always being at the desk. It's not my, I thrive off that engagement I have, and that makes a difference. So definitely still within, somewhere in the care environment, definitely. But gynae nursing was a good one. Or somewhere that was supporting people on their journey.
Nice. I think, what would I do? I wanted to be a children's nurse. But the same reason as to why I just couldn't imagine, like, if something was to go wrong. I definitely would not do midwifery. It's absolutely not for me at all. Why not? You don't like it? No.
So midwifery out of question.
Yeah, absolutely out. I don't really know. I think gynecology is what I've found interesting. I am enjoying it at the moment. If it wasn't that, I don't really know what I'll do.
So would you go into something like fertility? Do you know gynae? They lot of people have been in there, have a lot of things into that. Have a good fertility nursing.
Maybe, but I don't think that's as interesting for me. I think for me, maybe like research nursing, because I find like the whole idea of women's health so interesting, and the fact that there's still so many different stuff to do with like endometriosis and fibroids that still have not been like discovered. Like I still don't know the reason as to why these things.
And we haven't been educated on.
Exactly.
We don't find out something about our own health until you actually have the condition.
Exactly.
And such limited information about it. So it's crazy, really.
And the fact that it takes so many years to even have a diagnosis is crazy in itself. So it's something that I feel like research.
Really passionate about.
Yeah, I'm really passionate about.
Like you said, there's different scopes. Research nursing definitely something on the agenda.
If you guys see me being research.
There we go, we found it. You heard it here first. Alright.
What has been your hardest experience being a midwife and your best experience?
I think my hardest experience being a midwife was probably my student journey. I think being a student midwife, I didn't do it in London, I did it in Leicester, and I had a really bad mentor in my second year, and I think that was the deciding factor whether I was going to actually stay on this course, still be a midwife or not. I experienced racism at a time of my journey of midwifery, and that racism I received was just, it made me having to take have to stop that second year and take a year out of midwifery.
Oh, wow.
So because the midwife that I was working with, she failed me basically for no reason at all. She failed me, and then so obviously with the way midwifery, kind of like nursing, quite a tight course. You only have like 6 weeks in the whole year of like 52 weeks to do the course. And so even though when we went back and forth and did the investigation and found out that was right, I still wasn't enough time to catch up with my peers. So I remember my peers went ahead of me. I took my time out, and I was just thinking that, do I want to still keep doing this, prove them wrong? And I did, because I knew midwifery was where I wanted to be. So, but experiencing that was really, really hard, because obviously I've been told that basically things just gone, went to college, went to university, and just mapped out, and it's something I'm passionate about, and I had to fight for myself being the racist and really being put down, but also the course itself is really hard, and then having to find a new system of peers in a new class to bounce off in, and then also working in my year out thinking, do I want to go back, should I go back, and just felt new again. So I think experience racism as a student, going back, and then just the first 3 or 6 months of being a midwife in my newly qualified year was really hard, and I think, but it shaped me, hard but in a great way. I went through every single thing that could go wrong, anything that could possibly go up, all the objective emergencies that we learn, I experienced them all. I had all the bad things, but it's crazy because although at the time it seemed like, oh my god, but I think like I became more confident because I overcame it. So now when those things happen, I'm not as phased by it. I thought like, okay, it happened, and now I knew what to do. So I had really good support by the colleagues that were my professional, newly qualified supporting people. So that was really helpful. But I think student experience into my 3-6 months being a new government was really hard. But I think those things made me grow a thick skin. I felt like, if I will calm down, then I can do anything. And I think it's given me that candy attitude of wanting to prove everybody wrong and be like, I'm going to do that now. In fact, I put myself in situations where I'm thinking, can you do that? I'm like, yeah, I can.
I love
so
that.
things like that, I can do. So, when you've got passion for something and you know it's what you're supposed to be doing, no matter what you may face, you're going to keep doing it.
Love that. That's really inspiring as well for anyone watching.
Yeah, so don't worry if you have faced obstacles in your student life. If you want to do it, keep going. There's a way, And then here I am, nearly 11 years later in this thing of the past. Yeah. Thanks. Yeah.
Wow. Okay. I think what's been my hardest? I think my hardest moment was university as well, but specifically in my final year. Like you explained, like working or being a student outside of London is
different,
completely different to what you're used to. You're away from home, you're away from your family, and like you as well, like we were young while starting. So it was really difficult, even though I had friends who I'm still close with now, who were supportive, and we literally lived together. But sometimes just waking up in the morning, going to placement at like, what time did I leave? Third year. It was at 4 a.m.
Crazy times.
4 a.m. in the middle of nowhere, waiting for a bus. Like it was too much. It was too much. But also like my dissertation was just a whole load of stress as well. Being able to really express yourself. Being able to feel comfortable in the environment that you go to for placement is really hard, and assignments within itself are hard. Everything's too much, like financially as well.
Especially going in young.
Yeah.
I think I think we haven't spoken about, but I think you brought about. I think it's really good to let people know as well, is that how, like you as well, like you're 18, right? So starting 18, I felt like people looked down on you. Yeah. Especially on your course, was there more mature?
A lot of mature students.
Like me, I was one of the youngest. I think it was 2 of us. I was the youngest out of all my class. Everyone was way older than me. So they looked down at me like, what is this girl? What is she doing? You look young. They didn't take you that seriously. And even when you qualified, people, you have to prove yourself to them. Like, when you see that young doctor, you're like, oh, what did he young doctor? But that was you, when you become like a nurse midwife and people in your ward, people want to look at you like, do you know what they're doing? You look too young to be my midwife or my nurse. And I think that can also have to be like like, how old are you? And then I remember delivering like, oh my god, it's my first year, I thought you were my midwife. I'm like, oh, how old are you? I'm like, So there is a stigma as well. When you're young and start off, you feel like you have to prove yourself extra because people look at you like, does she know what she's doing? She's a young girl, And I'm happy that you said that you had your peer support, people that did. Unlike you, I did the silly thing. I generally had friends that came to university with, and their course was completely different to what I did. So our lifestyles were different. Like you said, I had placements. They just went to university.
Yeah,
It's different.
It's very, very
and
different.
I think initially I was supposed to have fun with them as well, but I just had to realize at some point it's different.
It is.
I do night shifts. You guys don't. You know, there's something I couldn't make with them. I had, even when they were back in London 3 months enjoying their lives, I didn't have that 3 months off. I had placements. I was like, and being young, you know, like doing that and having your friends like, can you guys like, no, I've got a night shift. They're like, oh, right? We're still going, you know, and that can be really hard, you know, to face that as students. So that's another reason. So I'm happy you had people amongst you. I didn't live in the halls with midwives. I lived in my own private halls. But some people that was a good thing to live in those halls with midwives. But that was one thing that I think I would always advise them to do is have peer support. Be around people that do the same courses to you, because nursing midwifery is so different from the average course, and you need those people around that understand what you're going through day to day, do placements, do assignments, and understand that balance is so vital. I
100% agree. I feel like if you're watching this and you've been reluctant to speak to people in your course, definitely start speaking to them, become friends with them. 100%. You guys have got each other at the end of the day. Even if you're not helping each other with your assignments, but just the thought of being able to speak to somebody is more than enough. Going to placement together.
Yeah, definitely.
Literally. Okay, so now we're going to speak more about you. Don't worry, we're almost done.
Right.
Okay, so what inspired you to start content creating?
Keep up with the times. I feel like, you know, the generation now, everyone is about social media. I feel like it's the best way to get across your point, best way to reach people. When I started having like my more brand, having to build a business about my private services that I was offering in terms of midwifery, in terms of infant first aid, in terms of like antenatal classes, in terms of birth was all the things I was doing within my professional auntie brand, and even in the products I created. How best would I get my message across and reach the platform? What's the type of platform on Instagram? Now TikTok's amazing, but I mean those kind of platforms, and you saw people doing it, and I had to start from somewhere. I'm not necessarily the best person. I like to create content all the time, but I had to learn somewhere. I started from somewhere, seeing other people's information and insight, and having that little kind of thing. So I think what inspired me was basically thinking, how can I reach a lot of people at one time? How can I get my message across easily? How do I do that? And what's available to people now? Instagram, social media, websites, and that's what I went with when I was beginning to make my business be noticeable and reaching an audience. That's what really inspired me.
Love that. So just to wrap it up, if you just explain like your YouTube series that you've been doing, just shout yourself up.
Thank you. So I'm a professional auntie. My name is Kemi. I'm a midwife. I also have a business called Professional Auntie, but also starting a YouTube series which is more about lifestyle for parents, for people that mothers, fathers, but also reaching that part of parenting not always often discussed. So we'll talk about various topics. We start off with one recently, Can Mums Have It All? And that's really one on YouTube. You can find Professional Auntie YouTube, and we'll be launching another one next month. I do antenatal classes, baby massage classes, first aid classes. I do products for mum, baby and dad, and I do all sorts of things. You can find me at Professional Auntie Instagram, Professional Auntie TikTok, and www.professionalauntie.co.uk is my website of information, and hit up my DMs. I do respond.
So to wrap it up, thank you so much for coming. Make sure you follow her on all her social medias. I'll leave it just there. So make sure you follow Kemi, and thank you very much for watching this video. I'm sure you enjoyed it. I'm not going to say I hope you enjoyed it. I'm sure you enjoyed it. Thank you so much, and tune into the next video. Thank you everyone.
Thank you.
Bye. Everyone, welcome back to my YouTube channel. So I'm here with
Nursing Z.
Today's video will just be explaining to you guys a project that we both teamed up with. We're really excited to show you all what it's about, so keep watching to find out.